Hi, this is Transcatheter Aortic Valve Replacement by Brandy Peterson, Medical Careers Institute, online campus, June 2016. Did you know that according to American Heart Association, over 17 million people die every year from cardiovascular heart disease? That's 1 in 3 deaths caused by heart problems. That's more than any other cause, including cancer. This speech is to inform people about aortic stenosis, a life-threatening valvular heart disease, and a new, minimally invasive, life-sustaining treatment option called transcatheter aortic valve replacement. I will discuss what aortic stenosis is, how it's diagnosed, and what the treatment options are available for aortic stenosis. So I bet you're wondering, what is aortic stenosis? Aortic stenosis is a narrowing of the aortic valve. A normal aortic valve consists of 3 thin, flexible structures called leaflets. These leaflets open and close the valve, regulating the blood flow from the heart to the rest of the body. Aortic stenosis can have multiple causes. One is rheumatic fever. Also, there is a congenital heart defect called bicuspid aortic valve, where there are only 2 leaflets instead of 3, causing a narrowing of the aortic valve. In addition to aging, as we age, our arteries and valves tend to collect plaque and calcium, which cause our hearts to become hard and stiff, and the aortic valve specifically dysfunctions and is not able to work properly. Here's an example of a fully functioning normal aortic valve in the fully closed and open position. Here is one with rheumatic fever, age-related calcification aortic stenosis, and a bicuspid aortic valve. Here you can see how a normal functioning aortic valve is able to open all the way, and a congenital bicuspid aortic valve is open fully. However, that opening is narrowed due to only 2 leaflets available. Here you can see the effects of aortic stenosis in a normal functioning valve and aortic stenosis causing that valve not to be able to open or close properly. If you will, imagine your aortic valve being like a water spigot. When you want the water, you turn the valve on and the water flows through that spigot. When you're done, you turn the valve off and the water ceases to flow through the valve. The aortic valve is similar. When it becomes stenotic, it's not able to open all the way, allowing the blood to fully flow through properly, and it's not able to close all the way, causing a leaking of the blood or regurgitation. Aortic stenosis can cause multiple symptoms, some of which include shortness of breath, dizziness, lightheadedness, syncope or passing out, blackouts, or even chest pain. If you or someone you know are experiencing any of these symptoms, we really encourage you to speak to your doctor and really find out what's going on. Early diagnosis is the key to survival with aortic stenosis. Diagnosing aortic stenosis may include having a consultation and examination by a cardiologist. The cardiologist would listen to your heart and listen for a sound called a heart murmur that is caused from your aortic valve not functioning properly. In addition, a cardiologist may recommend that you have what's called an echocardiogram. That is an ultrasound of your heart that allows the doctors to determine if there's any stenosis visible on that ultrasound, and if so, what the severity of that disease process is. There are multiple treatment options available for aortic stenosis. The classic treatment option includes open heart aortic valve replacement. Open heart aortic valve replacement is typically a 4-hour procedure that includes an open sternotomy of the chest. It also includes the use of a cardiopulmonary bypass machine, which is a machine that circulates the blood during the surgery while your heart is stopped and your valve is being replaced. The typical hospital length of stay for a traditional open heart valve replacement is 5 to 10 hospital days, in addition to 6 to 10 weeks recovery time. In addition to open heart valve replacement, there's now another treatment option called transcatheter aortic valve replacement. Transcatheter aortic valve replacement is a treatment option available for those patients who may be too high risk or inoperable for the traditional open heart surgery. Transcatheter aortic valve replacement consists of implanting a valve through a catheter through the femoral artery, through a small incision in the chest, or through a small incision in the rib cage. Each of these procedures is approximately 1.5 to 2 hours in length, and the recovery time often is 2 days in the hospital and 2 weeks at home. In addition to open heart surgery and transcatheter aortic valve replacement, our patients also have treatment options available that include medical therapy, adjusting medications to help alleviate the symptoms that they're experiencing. However, there is no medication that treats aortic stenosis. Aortic stenosis is a narrowing of the aortic valve, and it obstructs the flow of the blood from the heart to the rest of the body. It can be congenital, it can be affected with age, it can be secondary to radiation therapy, or even rheumatic fever. There are multiple treatment options for aortic stenosis, and transcatheter aortic valve replacement is a good treatment option for those patients who may have been too ill to have another option before technology allowed us this treatment option. Aortic stenosis affects millions of people every year, and TAVR allows these people to have the benefit of knowing that they have a treatment option for their aortic valve stenosis. If you or any of your loved ones are suspected of having aortic stenosis, please see your cardiologist and ask them if you're a right candidate for transcatheter aortic valve replacement.